relationship between a clinician and the laboratory physician is extremely important for accurate diagnosis. While the clinician gives inputs on patient history, symptoms, and likely diagnosis, the laboratory physician can advise the clinician on nuances such as the correct sample, right time of sample collection, additional investigations if required, and of course, interpretation of complex test reports keeping in mind the clinical history. Diagnostic stewardship deals with getting the right test for the right patient at the right time. When there is good and free flow communication between the clinician and the laboratory physician, it helps in getting the right diagnosis in the shortest possible time, thereby helping the clinicians to initiate appropriate therapy. It also helps in optimal use of laboratory investigations, minimizing the unnecessary investigations, and improving the diagnostic services to serve the patients. At KMC Laboratory Services, we strive to achieve this every day, 365 days, 24 by 7.
The pre-analytical phase is the process from the clinician selecting the appropriate test to the test being performed in the laboratory. It's a critical phase, but it's also the most susceptible to errors as most of it is performed manually. Pre-analytical errors can affect the accuracy and reliability of laboratory test results. These errors can lead to misdiagnosis and inappropriate treatment decisions, significantly impacting patient health and safety. To reduce or nullify this, we have improvised blood collection processes by use of standard vacuum blood collection tubes for adequate sample collection, order of draw to reduce contamination, following safe practices during sample collection and waste disposal, barcoding sample collection tubes for correct patient identification, and automated sample transportation within the lab. Following standard protocols, regular training, and reduced manual intervention in pre-analytical phase has helped us to streamline our processes and contribute to patient safety.
Patient safety is a healthcare setup is a challenge. As an initiative, WHO in 2005 launched the first challenge, Clean Care is Safer Care, by addressing hospital-acquired infections and hand hygiene. The microbiology department, along with the diagnosis of infectious disease, is actively involved in the infection prevention and control policy making and implementation in the hospital. The infection prevention and control team identifies the gaps in the patient care and note the possible risk to the patients during the stay or any procedures through surveillance and data analysis. Processes and policies are drawn up to mitigate these risks. The basic IPC practices include hand hygiene, aseptic techniques, safe surroundings, adequate disinfection and sterilization procedures, and consistent infection prevention practices. The IPC team educates both the healthcare personnel and the patient party regarding the patient safety protocols.
The key function of the laboratory is to get the right report to the right patient at the right time. Correct and timely diagnosis is the first step to preventative interventions and effective treatment. At KMC Laboratory Services, the interface between our automated analyzers and laboratory information system, as well as RLIS and hospital information system, ensures seamless transmission of test results. Auto verification of reports also facilitates swift clinical decision making. With strict validation protocols and regular monitoring, auto verification has streamlined our workflow and reduced turnaround times. Confidentiality ensures safety of patient information and reports. While collecting reports, we require our patients to produce the bill to verify their identity and permission to access the results. Within the laboratory, we utilize secure communication channels, store reports in designated areas, and limit access to authorized personnel only. All of this is possible through the robust IT infrastructure, regular system updates, and periodic training for our staff here at KMC Laboratory Services. Safe reporting in laboratory settings is a shared responsibility. Every cog in the wheel plays a vital role in delivery of accurate and safe reports. Let us prioritize accuracy, confidentiality, and patient safety in order to get it right, make it safe.
Quality assurance in a clinical laboratory is essential to ensure that laboratory test results are accurate, reliable, and form the foundation for informed medical decisions and patient safety. At KMC Laboratory Services, NABL accreditation reflects our commitment to upholding the highest standards of quality, competence, and regulatory compliance. A key component of this commitment is internal quality control, which continuously monitors the analytical system during routine operations. Incorporating IQCs for all the tests aids in maintaining the accuracy and reliability of test results over time. Proficiency testing complements internal quality control as an external assessment tool, evaluating the laboratory's ability to consistently meet required levels of competence and quality. Quality is not a fixed destination but an ongoing journey. The integration of internal quality control and proficiency testing in our daily processes ensures the delivery of dependable and accurate reports, while our NABL accreditation since 2009 stands as a testament to our enduring dedication to quality excellence.
Risk management is an essential component of the quality management system of medical laboratories. Any potential error constitutes a risk. At KMC Laboratory Services, we examine all our processes from sample collection, processing of samples, and issuing of reports to identify these risks. By understanding the risks in a process, we can design ways to mitigate them. In the era of evidence-based medical practice, this cyclic process is at the heart of patient safety programs and paves the way for continuous quality improvement. To ensure the safety of our staff, patients, and the community, we follow best practice recommendations, including biosafety practices and biomedical waste management. At KMC Laboratory Services, we endeavor to provide a risk-free environment.